Welcome to Healthline 3. I'm Jade Balexa. We're taking an in-depth look at what may be causing your legs to ache. And joining me now to discuss peripheral vascular disease is cardiologist Dr. Britton Eaves of Willis Knighton Cardiology. Thank you so much for being here today, Doctor.
Hey, thanks a lot for having me here. It's an important topic and I'm glad to be here. Thank you.
Sure is. And on that note, I want to remind our viewers to call in with your questions at 318-219-4569 throughout the broadcast. Now, let's get started. Tell us, what is peripheral vascular disease?
I really want to divide today into two categories. Peripheral arterial disease, which is a disease that is caused by blockages in the arteries that supply some of the tissues of the body. Primarily what we're talking about today, of course, is the lower extremities, the legs. Really, we don't see that much in the arms for whatever reason. And then I want to spend a little brief time talking about venous disease, which is obstruction usually from a clot in the venous system that prevents blood from returning to the heart and causes aching legs and swelling and so forth.
Okay. So tell us, obviously, one of the symptoms is the aching legs.
Right.
So how do you know if it's maybe not just something else? I mean,
Okay.
how do you identify that?
That's a good question. You know, probably about 40% of patients don't have the classic symptoms. The classic symptoms of having decreased blood flow to your leg, which is really what we're talking about, would be somebody that they, let's say they walk a certain distance, and by the time they get to that distance, they have to stop because their calf muscle is cramping or burning, and they have to sit down and rest until it begins to release, and then they go on about their business. That would be the classic. That's called claudication. But some studies have shown as many as 40% of people don't experience that. And what they experience is their legs feeling, quote, tired or heavy, or they just can't walk as much. Or because a large segment of these patients also have other comorbid diseases such as diabetes mellitus. Sometimes they have neuropathies where they don't have complete sensation of their legs, and sometimes those patients will present with wounds or ulcers on their feet or toes that are slow to heal. And we can talk a little bit about that later on as well. So.
Absolutely. So how does one get treated for this?
Well, the first thing you want to know if you're at risk for it. As you get older, of course, just like with everything else, you're going to be more likely to develop any type of disease. But patients who are particular risk for the peripheral arterial disease are those who smoke, those who have hypertension, those who have elevated cholesterol, and those who have diabetes. And then also, if you have a family history of somebody who's had blockages, then that would be a concern as well. Venous disease is a little bit more complicated. It can kind of strike out of nowhere. But a lot of times we can really divide it into two types. Patients who've had, in medical school we learned it as Virchow's triad. If you have a history of having blood clots, that you had some other documented blood clots, you're more likely to develop blood clot in your leg. If you've had trauma to your veins, and that might be from a car wreck, some type of injury that you've had, or if you have had stasis, and that's something we really need to be aware of. It happens a lot of times after surgery when somebody is laying in the bed recovering from the surgery. That can allow the blood to pool in the legs and cause a blood clot. And if those blood clots migrate to the heart, they can cause what we call a pulmonary embolism, and those are often fatal, unfortunately. And there's a fairly, some steps that we can do to delay that. Also, people at risk should know that if they're on long trips, like on a long airplane, international flight, get up and walk around. You just want to get that blood pumping through the legs and moving back to the heart.
Okay, because my aunt always told me when I'm driving on long trips to get up and walk around. So there's truth to that. She's not just telling me that.
And the most simplistic, so let's say you're at home doing, recovering from surgery. The easiest thing that you do, and actually, I had a knee replacement 2 weeks ago.
I was going to say, be careful.
So just doing your feet like this. The calf muscles are the pumps that pump the venous blood back to the heart. So if you just do that, that'll help keep the blood circulating and lower your risk.
Okay, wow, that's incredible information. So when should I be concerned about pain with exercise?
Well, pretty much if you begin to have, you probably should start off talking to your primary care doctor. I mean, you certainly could have a joint problem, you could have a muscle problem, multitude of other things. But if you have some of the risk factors that we talked about, there's a pretty simple, the first thing is to have your doctor see if they can feel the pulses of your feet, which is just like the pulse on your arm. You have places on your foot that we can feel the pulses, and that's a basic little screen. And then also we can measure the blood pressure in the arm and the blood pressure in the foot. That's called a arterial brachial index, and that's another good screen. And then we have some other non-invasive things, ultrasounds to see if there's any blockages.
Mm-hmm. And that would be for the venous and the arterial diseases?
We have ultrasounds we can do for the venous. I would say the number one thing that would bring me to my doctor if I thought I had a blood clot that had formed, because those can be fatal, as I've said before. If you develop sudden onset or fairly, of one leg versus the other. When we have both legs involved, that usually, not always, but can indicate more of a systemic problem, maybe too much salt, too much fluid in our body, other things we don't have time to talk to about in this segment. But if you have one leg that is suddenly more swollen than the other leg, you should certainly have a physician evaluate it to make sure you don't have a blood clot there, because they actually can develop even people sometimes on a long car ride, just like your aunt told you. It does happen. Mm-hmm. We see it in truck drivers sometimes.
Yeah, because they're driving for hours and hours at a time. Where do these blood clots often develop in the legs? I mean, are you talking about the calves or the thigh?
Well, so we're talking about the arterial blood clots can start all the way from the artery here, all the way down. Sometimes we have to do some sophisticated stuff and actually even go in and rebuild the artery. The good news is science has advanced so much, we still utilize our surgical colleagues all the time, but a lot of what I do, or everything that I do, is done to a catheter. So it's not surgery per se. There's no putting on a breathing machine, making incisions. It's all done through a catheter. But as far as the blood clots in the legs, the one distinction I will make, because this is an area of becoming more and more interest. More physicians are spending more time treating these kind of things. So if you have a blood clot below your knee, there's probably a 90% chance that will resolve with blood thinners and follow up with your physician and not be a danger. If you have a blood clot above your knee, then there's only about a 50% chance that'll completely resolve with blood thinners. And again, I could obviously talk for a long time on this, but there are other things, venous compression syndromes and so forth. But anyway, if it's above your knee, you should probably ask your primary care doctor to send to somebody like me or other people in the community that are doing more intensive venous evaluations and treatments, because we can actually stent the veins as well, and we also have devices that can aspirate or suck the clot out. And so there are a lot of things we can do, because if it's above the knee, there's only a 50% chance that it'll be completely treated long term, and you can end up with long-term swelling and achy legs, as we said. Mm-hmm.
Do those clots come back? Can they come back?
They can.
Once they're removed?
Again, all of these diseases are multidisciplinary. Mm-hmm. So what we usually do, we ask our colleagues in HEMOC to evaluate and see, was this just a one-time thing from being stasis or, sitting up still, or trauma, or is this an underlying problem with the blood clotting cascade? And so, but usually they'll have to be on blood thinners for a while. Mm-hmm. So that's a new area, but we do a lot of treatment for peripheral arterial disease as well. I do tons of that.
Okay, let's talk about that some more.
Okay.
What sort of treatments are offered for the peripheral arterial disease?
Oh gosh, we have so many tools, and I have a laser. I have devices that spin 100,000 revolutions a minute, the little saws and dimes that pulverize things. We have balloons. We have drug-eluting balloons that when we blow the balloon up, releases a drug that prevents scar tissue from forming. So we have a lot of tools in the toolbox, and the most gratifying thing, though, which really, start off as a cardiologist, the most biggest thing that really made me feel passionate about this. A lot of times, we fix somebody's heart attack. Obviously, it impacts their life and they feel good, but they go back to the way they were before and all that. And before they had their heart attack, it a lot of times wasn't something that impacted them every day. They didn't run around with all this chest pain. It was something out of the blue, then it got fixed and went back to their life. When you have a patient, that every time they walk out to their mailbox, they have to stop before they walk back, and because their calves hurt, and you fix that. We have patients sometimes that have to, at night, they have to hang their legs off the side of the bed to allow gravity to pull enough blood flow down there so they can get sleep. If you can fix that, and certainly if you restore blood flow for somebody, some diabetic that has a wound that's failing to heal, and the surgeon is saying, listen, this doesn't get healed, we're going to have to take your leg. You can do that. I don't mean, many people in this community do this kind of work, and I'm sure feel exactly the same way. So it's not about me. Not what I'm trying to say.
It's about improving someone's quality of life.
Right.
That's got to be rewarding to you.
I'm like everybody else. We all get up some mornings and are grumpy, and some days we're not. But I feel very fortunate to be in a profession that I can do something, and then you get so excited someday to see somebody back in clinic. How you doing? And they're like, oh my God, I didn't realize I was doing as bad as I was. So it can be very gratifying.
Exactly. How has the technology changed? Are you seeing new technology in your field?
Oh, tons of new technology. Medicine in general is really advancing. Gosh, when I first started out, we talk about this sometime. Boy, there were long cases, and we had limited tools to do them with, and so it's gotten much better, much better. Thankfully, there's much smarter people out than me making new things to help us all out and make us look smarter, even if we're not. So,
yeah, the advancements are so vital to your profession and making people's lives so much better.
Right.
So, well, let's get back to the legs and the swelling and all that, because I know people out there probably have a lot of questions on that. What about swelling in legs, particularly one more than the other? Talk about that feeling and what people need to know about that. Okay.
So let's say you had a surgery, or actually sometimes people will get sick. We saw during the COVID epidemic, there definitely was some association with thrombosis. That means clot formations. We saw a lot of patients during that time as well. But sometimes, so you could have somebody even recovering from something like pneumonia or something. Let's say they went home and they'd just been pretty sick, didn't feel good, kind of, say, I'm going to take a little time. I'm going to prop up here on the recliner, prop up in the bed, and get to feeling better. And that goes on for 3 or 4 days. It can be that simple. So what you would have is a swollen leg, one more than the other. Not always, but that implies that it's not a systemic, not a body issue. It's a local issue. So the one leg swells up. Many times it'll be warm to the touch compared to the other extremity, more swollen. Oftentimes it'll be red in appearance, and sometimes there can be pain associated, particularly if you squeeze. And so it's pretty easy to go see. You could, I'm sure, go to Quick Care, whatever. Pretty easy for somebody to assess it and say, let's get an ultrasound, which is the same thing, same technology, you know, in OBGYN, the docs look at the babies with. We use that to look at the arteries and the veins and also the heart, and that can be pretty quickly tell us whether there's a clot there or not.
Yeah, wow, that's amazing, because yeah, you definitely know, because I mean a blood clot that can kill you.
Absolutely.
So you definitely want to take precautions if you're feeling that way, or
Right.
notice a difference in your legs.
Yeah.
What about those blisters you were talking about earlier, or sores that are slow to heal?
Okay.
Tell us about that.
You know, that's a particular, we mentioned before the people that had the risk factors and had, you know, difficulty in exercising and walking, and for sure they should mention that to their primary care doctor, and so that can be worked up and evaluated. But what you're talking about really is a critical issue. Many times the people that, again, that we're talking about may have neuropathy, which is a condition where the nerves of the lower extremities cause burning and tingling, and a lot of times cause numbness. That can cause a multitude of things, but it also happens in diabetes and so forth. Anyway, a classic scenario that we'll see a patient that, let's say, maybe had some shoes that just didn't fit properly, or maybe they had a rock in their shoe or something like that, or maybe they scuffed their foot on something. And you know, they're just the type of person, oh, it's going to get better, I don't need to go to the doctor right now. And then it continues on. Some of those people don't have enough sensation to even really know how significant it is. Anyway, the bottom line is, if these wounds don't have enough blood flow to heal, then of course it becomes necrotic or gangrenous, and the tissue has to be removed. But here's what I think a lot of people don't realize: if you have severe circulation, it has to be removed to a point where there is good enough circulation for the surgical wound to heal. So that's a big deal. Sometimes, you know, it may be a sore on the toe, but there may not be good blood flow up until the knee.
Mm-hmm.
Now, the good news is on that, you know, there are multitudes of ways. Usually I get a call and say, hey, there's this person that has a wound here, you know, it looks pretty bad, you know, but before we set them up for an amputation, because that's really what we're talking about. People still lose their legs even now. They say, can you do a look at them, see if there's a way to reestablish blood flow. There's no cure for peripheral vascular disease, and sometimes in these severe cases, the work that we do doesn't stay permanent. The good news is, though, as long as it's open long enough for the wound to heal, it takes less blood flow to keep the skin intact than it does to heal the wound. So anyway, so, you know, there's a wide spectrum. There are people who have decreased exercise utilization of their legs when they exercise, and then there are patients who are at risk for losing their legs. There's a big spectrum in there, but there's a multitude of things that we can do. And myself and other people in this community as well are very passionate about it. My goal is to, you know, if somebody's going to lose their leg, it's because the good Lord said you're losing your leg. Barring that, we are full bore ahead.
So it's really important to just be in tune with your body and go to the doctor when you notice something wrong.
I would tell for sure all diabetics, as a rule of thumb, and I say all, you know, sometimes people have sort of the mild diabetes, and, you know, but a true person who's really suffering from diabetes, they should make a daily routine. If they could do one thing every day, whether they do it or their spouse or loved one, every day when they take their shoes and socks off, have somebody just give a quick once over to look at their foot, see if there's any wounds there. I'm sure people are, I'll just say though, keep your feet clean and dry and inspect them daily. And if there's a wound there, go to your primary care doctor and have them look at it. But that would keep a lot of people out of trouble right there. We actually have people that have bad enough neuropathy, their feet are cold because they don't get enough blood flow, and they'll put their foot close to a heater in an attempt, and come in with sometimes third-degree burns. That's how significant the loss of sensation can be. So it's very important for people with significant diabetes to examine their feet. And I will say too, I mentioned multidisciplinary. I work very close with the podiatrist. In fact, I get a lot of times the podiatrist will call me because they'll be doing something on the foot and say, look, we don't really feel good pulses here. We're concerned about the blood flow. Work very closely with the wound care doctors for the same reason.
And how or why do calves ache or people get tired when they walk?
Well, it's a supply and demand, so the blood flow is designed to bring oxygen, which is the primary, and then other nutrients such as glucose, to provide energy, and then of course electrolytes that make the cells themselves contract. And so if any of that is decreased, there's a certain curve, demand versus need, and once the two become a mismatch, that's when you start having the symptoms.
That's what happens. Okay. So Mark is on the phone. Mark, thank you for calling. What is your question?
My question was, I got swelling in my right ankle every now and then, like if I walk pretty good bit, and and my knees hurt a lot. I hurt to the point that I have to rest them for a couple of days before I can get back on them real good. And I'm just trying to find out. I had two ultrasounds done on them so far, and I had a back surgery a few months back, and I'm just trying to call and see what could it be,
Yes, sir.
because they checked
Your ultrasounds were both
checked for a block.
Your ultrasounds were both
Maybe.
normal. They said your blood flow was good.
Yes, ma'am.
Yeah, it really sounds like just based on the two sentences you're giving me, not knowing your history, with it being your ankle and it's every couple days, and then you mentioned your knee, and then you've had back surgery. I would suspect that probably most of this is significant arthritis. But follow up with your primary. If you've had normal ultrasounds that show normal blood flow, those are so good it'd be highly unlikely that this is from decreased blood flow to your legs. It's most likely a problem with arthritis.
Bad arthritis in it. Yeah, because I have to rest it. I have to keep it like level with my cocked up like in a recliner or something.
Right.
Before my ankle goes back down, for a couple of days.
Well, yeah, and particularly if it's just one ankle and it's just at the ankle. Mainly what I'm talking about, leg swelling, is really usually from an area from the knee down, and primarily the calf muscle itself having the majority of the swelling. Usually if the swelling is at the level of a joint space, not always, but most likely it is arthritis.
Okay. Well, I had to check with y'all.
Absolutely, sir.
I seen the doctor on TV, and I seen that he was in what do you call it, mammopathy, or I'm not pronouncing it right, but
cardiomyopathy.
Yeah.
Yes, sir. Yeah, people can get leg swelling from that as well, and that's associated with congestive heart failure. But they'll typically get swelling in both legs that is fairly equal, because that's just a matter of the gravity pulling down the excess fluid, and so both legs swell, but they're pretty much equal usually in that disease.
Yeah, it's mainly in my ankle and my foot,
Yes, sir.
It's where it's at. So, but anyway, I wanted to get y'all's, y'all intake.
Yes, sir.
on
Well,
it.
thank you for calling, and I hope you get some diagnosis and get some treatment and some relief.
Thank you, Mark. That was a good question, because so it would mostly be the swelling in your calf,
Right.
not your knee or your ankle.
Right. But the bottom line is, if you have a question, go see your healthcare provider. I mean, that's what we're there for. You know, if you're not sure, the best thing is to make sure to check it out. But yeah, that's classic. It's the calf that usually is what's swollen.
All right, we have another caller on the line. Good afternoon. Who am I speaking with?
Dale Cox.
Hey, Dale. Thank you for calling. Dale, what is your question for Dr. Eaves?
Well, I blacked out in the kitchen and fell and broke my left arm. I went to the VA and VA admitted me. And while I was in there, I'm diabetic and my blood sugar usually runs high. So they asked me if they could give me insulin, and I declined for a day or two. But eventually I agreed, and they give me 2 shots of insulin. I was in the hospital 3 days, and both my feet swole up. I couldn't get my shoes on. Then they released me to heal on my own, my broke arm. And about 3 days later, the swelling in my feet went down, but my feet have been numb ever since. And that was about 1.5 years ago. And my feet's still numb to this day. And like I said, my blood sugar usually runs in the 300s.
Well, just based on the fact that you have, you know, absolutely have diabetes, and many times it's been poorly controlled, you absolutely should, you know, have a cursory evaluation. I mean, your goals would be to get your cholesterol under control. You need to know what, your diabetes under control, but you also need to know what your cholesterol level is to get that under control. Get your blood pressure. If you're smoking, you need to stop that. And it absolutely would be reasonable to get a ultrasound on your lower extremities to see if you have any peripheral vascular disease. No doubt, for sure. And I know for a fact I have some people that I worked with, went to school with over at the VA in cardiology, that should you have an issue with your vascular disease, I believe you'd have some people that can help you out on that.
Thank you, Dale.
Yeah, I bought a foot vibrator recently, and it's helped.
Well, good.
It's actually got a little feeling
Right.
back in my feet.
You most likely, what you're describing, although you should have the other evaluations, what we mentioned before, was the neuropathy. And so again, the main thing that you need to do is, with your sugar being what it is and your nerve problem being what it is, every day you need to examine your feet and make sure that you don't have any wounds developing on your feet. And if you do, you need to let somebody know sooner rather than later.
All right. Well, thank you so much for calling. We appreciate you guys calling and getting your questions answered. And overall, what can we do to reduce our risk of having peripheral vascular disease?
Well, again, you know, a lot of things that we don't want to do. Some are easy, and some are a little bit out of our control, and some of them are not. You know, what is under our control is our diet. You know, obviously, just like I do want to mention too, peripheral vascular disease, because it's an arterial disease, it has a high overlap of also having coronary disease. The blockages in the heart arteries are carotid disease, blockages in the arteries of the neck, which can cause stroke. They all share similarities on their risk factors. So if we smoke, we need to quit smoking, period, end of story. It's a high risk. Diabetes, need to follow our doctor's instructions according to our diet, take our medication, try to get our diabetes under control.
Check our feet.
Check our feet.
Yep.
Cholesterol, we need to know what our cholesterol profile is. We need to diet, exercise, medication, whatever we need to do to get that under control. And exercise.
Good advice there. And tell us how people can reach you if they have any additional questions.
Well, I'm at Willis Knighton Cardiology. I've got a lot of partners. My personal office is Willis Knighton Bossier. You can look on the website. You can look in We don't have
Yeah,
phone books anymore.
I saw
so.
your profile set up there, so that's a great way to contact you. And thank you so much for
Thank you
joining
for
us
having me.
today. It's been fun and
Been fun for me too.
absolutely. Thank you for watching this edition of Healthline. Have a great day.